Oversight Committee on Housing and Human Services is called to order. Will the clerk please call the roll?
Chairman Irwin?
Here.
Senator Santana? Here. Senator Kavanaugh? Here. Senator Baer? Here. Senator Schenck? Senator Chang? Senator Sherry? Here. Senator Geis? Senator Lindsay? Here. Senator Hoytinga? Senator DeMoose? Here. Mr. Chairman, you have 9 members present. There is a quorum.
Thank you. I'll now entertain a motion to adopt the meeting minutes from the committee meeting on June 24th, 2025. Motion made by Senator Santana. Without objection, the meeting minutes are adopted. I'll also make a motion to excuse the absent members. Seeing no objection, the absent members are excused. Today, the intention is to adopt an S1 sub on Senate Bill 309 from Senator Santana, the vice chair of our committee here. And I'm going to invite Senator Santana to summarize the bills and the sub for us. Before we get started, we also have public testimony from a number of folks who are here in the audience with us today. So I think we're ready to get started. And if you could approach and prepare to summarize the bills for us, Senator Santana, we would appreciate it. And while you are getting ready to offer your explanation, I want to thank you, Senator Santana, for championing this issue. It's an important one, and I know there are a lot of people in my community who have been talking about the success of this program and the potential to extend it to include more people. So I'm eager to learn more, and I appreciate your leadership on the issue.
Thank you, Chairman Jeff Irwin, for taking up this bill today. Good afternoon, fellow members of the Housing and Human Services Committee. I'm grateful for the opportunity to speak to you on behalf of Senate Bill 309. As a mother of 3 and a proud supporter of Michigan families, I believe that Senate Bill 309, the RX Kids program, is a vital step forward for our state. The RX Kids program specifically aims to address healthcare disparities faced by low-income families in Michigan by providing direct financial support to ensure that mothers and their babies can access essential healthcare services. This cash assistance helps remove economic barriers that often prevent families from obtaining necessary items such as baby supplies, food, rent, utility bills, and clothing. By alleviating the financial burden, RX Kids enables at-risk families to seek regular checkups, vaccinations, and necessary treatments without the stress of unaffordable cost. Additionally, the program promotes healthier pregnancies and early childhood development, which are critical for reducing long-term health disparities. The RX Kids program measures its long-term impact on reducing health disparities among participating families, although through a combination of comprehensive evaluation methods. These include tracking health outcomes such as improved births, weights, low rates of infant and maternal mortality, and increasing vaccination coverage. The program also monitors healthcare utilization patterns, like regular prenatal and pediatric visits, to assess whether families in accessing necessary care are more consistently. Additionally, RX Kids conducts surveys and collects feedback from participating families to understand the improvements in their health knowledge, behaviors, and overall well-being. Over time, data analysis helps identify trends and measures progress towards reducing disparities. By comparing these metrics against baseline data and control groups, the program evaluates effectiveness in promoting equitable health outcomes and informs ongoing improvements to better serve vulnerable communities. It should be noted that research further demonstrates that RX Kids moms have higher trust in both government and in healthcare institutions. Michigan's future depends on a strong, healthy children, and these programs help to remove barriers to mothers that can give their babies the best start in life. I look forward to the expansion of this program to other much-needed areas around the entire state. I wholeheartedly support RX Kids because every child deserves a healthy beginning. and every mother deserves the resources to nurture that future. So also, we talked a little bit about the substitute and the changes that are part of this bill. So I'll just specifically speak to the details of those as well. Substitute 1 changes, it clarifies that DHHS contract with Michigan State University will be established to administer a program. It also fixes drafting error for conditional payments and unconditional payments to those families. It removes requirements for DHHS to establish an income-based eligibility requirement. Instead of the program would be a universal within the service area. It also removes the requirement for 2 years of local matching funds to establish a service area. Instead of matching funds, there will be one of the factors to establish a service area. And it also adjusts the administrative cost cap from 5% to 15%, which also will help to give just a little bit further dollars towards helping with supporting the program from the administrative side. So those are the changes to sub 1. And I will be glad to take any questions. Thank you for hearing the testimony. And I know that there will be several experts speaking today who also can help to support any other questions that may arise. So thank you all so much.
Thank you again, Senator Santana. Appreciate your testimony. I'm not seeing any questions from committee members now, so I want to welcome Dr. Mona Hanna up to testify, who is the director of RX Kids and is Associate Dean of Public Health at Michigan State University College of Human Medicine. And while she is getting ready to offer her testimony, I want to just adopt the sub now while we've got everyone here, just in case any members have to leave, because we've got a number of folks who want to testify on this. I want to make sure we get that work done. Also, that way we're testifying on what it is, hopefully, we've got before us, and I want that to be the sub. So with that, I want to entertain a motion to adopt the S1 version of Senate Bill 309, motion made by Senator Santana. Will the clerk please call the question?
Chairman Irwin?
Yes.
Senator Santana?
Yes.
Senator Kavanaugh? Yes. Senator Baer? Senator Shink? Yes. Senator Chang? Senator Cherry?
Yes.
Senator Geis? Senator Lindsay? Senator Hoytinga? Senator DeMoose?
Yes.
Mr. Chairman, there are 8 yeas and 1 nay. The substitute is adopted.
With that, we have the S1 version adopted, and we can move on with our testimony. So with that, if you could take it away, Dr. Mona Hanna, and tell us about your experience as director of this program.
Thank you. Thank you for this opportunity to be here with all of you. We're so grateful. Thank you, Chair Irwin, Vice Chair Santana, everybody who is here. I want to also thank you for your leadership on policies that you are working on every day to strengthen our Michigan families. So I'm here to talk about RX Kids. Senator Santana really said everything, so thank you for that beautiful summary. But RX Kids is a nation's first. It is the first mom-baby cash prescription program. We call it a prescription for health, hope, and opportunity. Although it is the nation's first, it is not a brand new idea. This is not genius. This is not some kind of rocket science amazing thing that we're doing. It is a program that is done around the world. 70% of countries have some sort of child family allowances, and every peer country in the world has some form of paid parental leave policy. So this is not a new brilliant idea. This is something that is really based on global and domestic evidence. Here in the U.S. during COVID, we did something amazing as a country. We gave most families unconditional monthly cash allowances when we expanded the child tax credit. The expanded child tax credit dropped child poverty to the lowest level ever in the U.S. and improved a whole host of outcomes, health outcomes, housing stability, nutrition stability, improved child welfare outcomes. The list went on. That was not continued by the federal government. However, many states adopted their own state-level child tax credits. There are now about 12 states that have their own child allowance program. So you can think of RX Kids as like a teeny tiny, time-bound version of a child allowance program. Because it is just laser focused on moms and babies. That's it. This is the earliest, kind of most consequential time in a family's life is pregnancy, infancy. These are the months when a child's brain is developing at lightning speed, like lightning speed. Literally in the first year of life, your brain doubles in size. And it's also a time when stress and scarcity can have lifelong impacts. What happens in this really neurodevelopmental period can shape your entire life course. And it's also during this window that families face the steepest expenses. It's unprecedented. It is the greatest economic shock for families because they need to buy things like diapers and cribs and still pay for rent and food. So the most economically vulnerable window is also the same window of life that is the most neurodevelopmentally vulnerable. This is also compounded because families lose incomes. Mom have to often come out of the workforce, so there's a drop in income, and there's an added cost of caregiving and childcare. These challenges are all very much compounded when folks live in poor communities. So ARCS Kids is just a simple answer. It is efficient, it's prevention-driven, it's a common-sense solution to this window, this very brief window of economic and neurodevelopmental vulnerability. ARCS Kids is a place-based program. So what that means is every pregnant mama in an ARCS Kids community receives $1,500 in mid-pregnancy. And then once a baby's born, it's $500 a month, either for 6 months or 12 months. There's no strings attached. Families have the freedom to choose what they need most. And that makes it a very administratively efficient program with not a lot of bureaucracy. ARCS Kids is an academic nonprofit partnership. It is led by Michigan State University College of Human Medicine, where I work as a pediatrician, a professor. I am the Associate Dean for Public Health. MSU, as you know, is our pioneer land-grant university, which was created to serve the state. And this is an extension of the work that we do throughout the state to serve the people of Michigan. It is a collaboration with University of Michigan Poverty Solutions, and that is like a reason to have a hearing for these two schools to work together. So we have been working together, our two great universities, on Team Babies. And the program is administered by Give Directly. They are the international leader in cash transfers. I know how to take care of kids. I know what families need, but we didn't want to reinvent the wheel. We are working with the leader, the international leader, once again, folks that deliver cash, verify folks, do program integrity, fraud detection. So this model combines the expertise of our two great universities with the operational capacity of a proven cash transfer organization. So we launched ARCS Kids in Flint in January of 2024. The city, as you know, with the highest poverty rate in Michigan, and actually has one of the highest child poverty rates in the whole nation. Flint, like so many places in our state and in our nation, is a place where the zip code that you are born into is one of the greatest predictors of your future health and wealth. And that's not okay for our babies. It is not okay for our babies to be born into hardship and scarcity that can impact their entire lives. I, as a pediatrician in Flint, like so many others, was tired of treating the consequences of poverty, the costly and sickening consequences of poverty. So we decided to prevent that. So thanks to your support in the fiscal year 2024 budget, a special thank you to Senator Cherry who led that effort. And thanks to philanthropy, notably our first funder, the C.S. Mott Foundation, which came in at $15 million, we were able to launch ARCS Kids in the city of Flint in January of 2024. ARCS Kids is a public-private partnership, and we have been able to blend TANF dollars, temporary assistance for needy families dollars, with other municipal support and other philanthropic support. So that means that every state dollar is matched and often multiplied by private investment, stretching our public resources further and maximizing impact. So since ARCS Kids began, which is literally less than a year and a half ago, we have been able to bring in almost $100 million in commitments. From public dollars and private dollars, from the state of Michigan, from across the nation, people who are so excited about this plug-and-play, common-sense, prevention-driven program. We launched in Flint, but now ARCS Kids is in 9 counties in Michigan, 9 communities in Michigan. We are in the city of Kalamazoo. We are in 5 counties in the eastern Upper Peninsula: Chippewa County, Alger, Mackinac, Schoolcraft, and Luce. We are in the city of Pontiac, and as of August 1st, thanks to Senator Huck and his leadership, we are in Clare County. And we are about, in the next few months, about to launch in 8 more communities in Southeast Michigan. So ARCS Kids is designed to be scalable and replicable. It is, once again, plug and play. It's already built. It is ready to go. We expand where there's need, it's data-driven, where there's local leadership, and the ability to raise match funds. We partner with communities like the Sioux Tribe that you'll hear from later today, as well as the Central Michigan Health Department, two of our champions who help spread the word about this program in our local communities. So what have we learned? Senator Santana talked about our rigorous research, and we are academics, so there's of course going to be rigorous research. So to date, we have prescribed over $13 million to over 3,000 families. Our take-up rate is phenomenal. It's near 100%. This is unheard of. Other programs, especially in this time window, like WIC, the Really Important Maternal Nutrition Program, has, for example, a 50% take-up rate. Home visiting programs have a 20 to 30% take-up rate. We have a near 100% take-up rate. Families know about the program, they value it, it's easy to sign up. Because of that near universal take-up rate, we can do a lot of great research. And what we are hearing from families and what we are seeing in the data is that families tell us for the first time they are able to breathe, to keep the lights on, to pay the rent, to put healthy food on the table. The top items that families spend these cash prescriptions on is number one, baby supplies. Anybody who's had a baby out there, you know babies are expensive. And when you break down what those baby supplies are, it's diapers. The diapers are the most common thing that they're agreeing, babies agreeing that diapers are expensive. So we've actually been shown that we've been able to reduce diaper hardship, which is actually like a survey measure that you can do. So families are able to afford diapers. They're able to afford rent. We have less back-owed rent, back-owed mortgage. And surveyed families last year, we actually had no evictions in our low-income families, which is phenomenal. Families have improved nutrition security, improved nutrition satisfaction, more able to buy the food that they need. We have health benefits that we're already seeing, improved maternal mental health. This is a really hard time for families and moms. We are seeing a significant reduction in postpartum depression, a reduction in anxiety, and a significant reduction in parental stress. We have a massive increase in prenatal care utilization. Mamas are going to prenatal care earlier. They're going more often. Because they're going earlier and more often, we're increasing the detection of pregnancy illnesses like gestational diabetes and hypertension. We have less smoking in the third trimester, and we are also seeing significant improvements in birth weight and gestational age. So babies are born bigger, healthier, born on time, and we are preventing NICU admissions. Just in the city of Flint last year, we prevented dozens of NICU admissions. These all translate to short-term, acute fiscal savings because of that prevention of healthcare spending. We are also preventing child welfare involvement. The peak age of child welfare involvement, the involvement in protective services, is the first year of life. It's more than double any other age. And it's largely related to kind of poverty and not having the resources families need to care for their children. We are already seeing in the state level data a decrease in child welfare data. I'm going to stop talking soon because we have babies who want to say how this program has impacted them. The Flint Chamber of Commerce recently released a report on why they love this program. They see it as a trickle-up program. Dollars are being spent in local communities, revitalizing those communities, supporting small businesses, strengthening neighborhoods, and giving communities renewed hope. So for me, the question isn't really whether we can afford ARCS kids. The question is whether we can afford not to do ARCS kids. Michigan is leading the nation here in showing what's possible when we invest at the very start of life. And we are now working with so many other states. We are working with about a dozen states who are interested in replicating what Michigan has already done. So that's super exciting. Another kind of amazing thing that we are exporting. We build great cars and all this other amazing stuff, but we also are building amazing, strong babies. So supporting ARCS kids is especially important right now, especially with recent cuts to Medicaid and SNAP and other federal social safety net programs, leaving too many families with fewer resources during the most critical months of their child's life. We can't control what happens with federal cuts, but we can control whether Michigan babies start life with the basics. An investment in Michigan's youngest residents pays off today, acute savings, but also in decades to come. It pays off in healthier kids, stronger families, and a more prosperous state. I urge you to take action in this session to expand ARCS Kids statewide. There is not a day that goes by when I do not hear from somebody from another part of the state that says, when is ARCS Kids coming to the Western UP? When is it coming to Detroit? When is it coming to Warren? When is it coming to Jackson? So I urge you to expand so that every Michigan baby, no matter their zip code, can have the healthiest possible start in life. Thank you so much.
Thank you very much for your testimony, and I want to personally thank you for your leadership in bringing together all these different public and private partners to help moms and babies in Michigan. I want to add to the chorus of people that you're hearing from, like you said, every day about how this program could be expanded to communities that I represent that I think could really benefit from this. And before I go to questions, I just want to thank you as well for bringing a dizzying array of positive statistics to the community and to the committee's work. Oftentimes we hear in this committee about some of those Medicaid cuts and some of those food assistance cuts and some of those increases to bureaucratic costs that are coming down the line here for state government. So it's great to have testimony about a program that is growing and doing good work and having a positive impact on the child welfare system and reducing evictions and increasing prenatal visits and a number of other positive things that these programs are doing. So thank you for directing these great programs. All right, with that, I want to recognize Senator DeMoose.
Thank you, Mr. Chair, and thank you, Dr. Mota. And our community, part of the region I represent, has been part of your pilot program, and the results have been stunning. And it's amazing how this program brings so many people together. I mean, finally, we're doing something we can all agree on. That's just sort of good news. I will say I have a question here, but there's a number of things I love about your program. It's so deliberate. I love that there are no strings attached, that you're actually trusting that parents are going to use this for the right things, that those maternal and paternal instincts kick in and they use it for that. You don't have means testing, which I think is a great thing because there's no stigma now. Everybody can go get this. It's also helped you to lead to tremendously low overhead, unlike so many sort of relief programs out there. I think you've shared with me the statistics. It's just amazing what I love how you leverage private dollars. And frankly, the thing I like the most, you had me at baby parades, that I love how this is changing the narrative. The kids are great for our society, and we know this. And just the thought of a parade in Flint of babies and people out celebrating is great. But one thing, getting to my question is, so often we here in the legislature are basically cleaning up after bad things happen. And I like the preventative nature of this. And I've studied a fair amount and been to even a conference on how critical the first years, especially that immediate time right before birth and that first year of life are, in terms of if those times don't go well, we end up paying for the rest of that child's life. Can you give me, so from that standpoint, I look at this as a great return on investment for the state. Can you fill in those blanks a little bit more of what are we avoiding by doing this, by acting now as opposed to cleaning up later like we usually do?
Thank you so much, and thank you so much for your support. One of my favorite quotes, which I really live by as a pediatrician, is from Frederick Douglass, the abolitionist, who said over a century ago, "It's easier to build strong children than to repair broken men." And too often we spend a lot of money and a lot of time repairing broken men. That's kind of the definition of our healthcare system. It is a sickness-based healthcare system. We have the most expensive healthcare system in the world because we don't spend money on prevention. And doing something like ARCS Kids is 100% prevention, and it's prevention at the most critical moment of life. This window, like I shared earlier, is there is not a more consequential window of life. We have learned so much about the concept of early adversity and toxic stress. And when you have a lot of adversity, especially in this prenatal infancy, early childhood window, in a very predictable and graded and multiplicative way, it hurts you later on. You have more chronic diseases. You actually have a lower life expectancy. So if we can surround children with goodness, especially in the first 1,000 days, that has a massive return on investment. So we see that play out, for example, in education, less special education. We see that play out in healthcare, less chronic diseases. We see that play out in criminal justice. We see that play out in all of these different buckets when we invest in early childhood. So lots of different societal savings. Thank you.
Thank you very much. Next, I want to recognize Senator Lindsay.
Thank you, Mr. Chairman. Thank you for the presentation. There's a lot to like about this. I got a couple questions, though. The shift, and Senator Santana explained, I think the sub went from capping administrative costs from 5% to 15%. Senate Fiscal also says, we're not going to, this is not, I don't think it's going to happen next year, but the maximum cost of this program, if we did it statewide and everybody was eligible and they all utilized it, could be $750 million. So that would put Michigan State University right around potentially getting $100 million, up to $100 million to administer the program. Do I have that right? And maybe you could explain some of the administrative side of things and why the shift from 5% cap to 15%,
Yeah.
or tell me where I'm wrong.
Yeah, so this is a super, super efficient program. So I don't know what the administration costs of other similar programs are, like WIC or child welfare or what have you. But this is unlike all those. For example, we launched in Clare County on August 1st, and we hired no new staff. There was no administration. We are not paying a lot. There's not a ton of bureaucracy for folks to administer this program. We are operating right now at about 15% total administration cost, which includes a very small overhead, but all the staff and the auditing and the cash delivery of this program. As we continue to grow, that administration gets even smaller with more opportunities of scale. So I think unlike most programs out there, this is one of the leanest and most efficient, which is why we included in your information an opinion piece from the Mackinac Center for Public Policy, which shares why they, as a conservative think tank in the state, support this program because of its administrative efficiency.
Thank you for that. And one other question. The way the program works on the front end has this cash that goes to expectant mothers. And I wonder from the administration side how, I didn't see in the appropriations for Flint or in this legislation how we're defining expectant mothers. And I'm particularly curious, what happens if a pregnancy doesn't come to term? What happens if it's never intended to come to term? Are they eligible?
Yeah, that's a great question. So folks have to prove that they're at least 16 weeks pregnant. That's when they can first get their prenatal cash transfer, the $1,500, and it has to be by a healthcare provider. So they have to submit verification that they're at least 16 weeks pregnant, and it's usually an ultrasound or some sort of medical documentation that is verified, and that goes through a verification process with Give Directly. So there's a safeguarding process and a fraud detection process. There's a lot of program integrity built in. We absolutely have had pregnancy losses, and we have a whole bereavement kind of policy after there is a pregnancy loss. But the money in pregnancy goes to the mom, and then once the baby's born, that money stays with the child, no matter kind of custody changes.
Thank you again, and thank you very much again for your leadership. Next, I have an opportunity to welcome up Kiana Jackson, who is a mom and a participant of RX Kids from Kalamazoo. It looks like we have one of our third-party validators also joining. I can't imagine a better person to have here to join us and help with the testimony. Thank you. Please.
So my name is Kiana, and I'm a proud mother of 3 wonderful children, Kedrick, Keelan, and Keesley. I'm truly honored to speak with you today about how the RX Kids program has impacted not just my life, but my whole family's future. I became a mom at just 18 years old. That experience changed my life in ways I never imagined. I stepped into motherhood young, determined to give my children the best life I could, but it hasn't been easy. There have been days filled with uncertainty, stress, and sacrifice, from doctor visits to late-night feedings to budgeting every single dollar just to make sure there's enough to get through the week. It's a lot. And I'm not alone. Every mom in this community understands what it feels like to give everything you have and still feel like it's not enough. That's why when I heard about the RX Kids, it felt like someone finally said, "We see you, we believe in you." $500 a month, no strings attached. It's not just money, that's trust. That's dignity, that's someone saying, "We believe you know what's best for your children." With that support, I've been able to provide my kids with what they truly need, not just the basics, but a better quality of life. I used that money to start a life insurance policy, something I never thought I could afford before. That decision wasn't just for me, it was for my children's security, their peace, and their future. But it's more than that. That monthly support means I can stay on top of my bills instead of falling behind. It means I don't have to choose between groceries and gas. It means I can sign Kedrick up for sports, buy Keelan a new pair of shoes when he hits the growth spurt, and make sure Keesley has his everyday necessities, like clothes, hygiene items, and the things that help him feel cared for and comfortable. And every time I make those decisions, I feel something I haven't felt in a long time. Freedom, financial freedom, yes, but also emotional freedom. The freedom to dream bigger for my children, the freedom to look ahead rather than just survive day by day. Some people ask, why cash? And I tell them because every family is different. What we need this month might not be what we need for the next month. Cash gives us the flexibility to handle real life as it comes. It treats us like capable adults, like the hardworking parents we are. What RX Kids is doing in Kalamazoo is bigger than a program. It's a movement. It's showing the entire country what's possible when you invest in families from the very beginning, when you believe that helping moms helps everyone. This isn't about handouts. It's about building people up, about believing that when you support a mother, you're supporting the heart of the home. So to everyone who made this possible, thank you. Thank you for giving moms like me a chance to breathe, to hope, and to build a better future for our babies. On behalf of me, Kedrick, Keelan, and Keesley, we are so grateful. Your support is changing lives one family at a time. Thank you so much.
Thank you so much, Ms. Jackson. Thank you again for your testimony. Next, I want to welcome up another participant of RX Kids from Flint, Celeste Lord Timlin. Please come on up and offer your testimony, and appreciate hearing from another person who is participating in the program.
First and foremost, thank you so much for having me. It's really an honor to be able to share my RX Kids story. This initiative isn't just a financial aid program, it was an investment into my family. When I found out I was pregnant, my husband and I both working full-time in affordable housing. We both have really cool jobs that we love, but we also experienced serious financial decisions. We were on a 10-month waiting list when I was pregnant for daycare. And daycare cost us $1,300 a month. And that is the daycare down the street in Flint, Michigan. And it was a stress that I really struggled with throughout the pregnancy until I heard about RX Kids. It allowed me to really think about how can I budget, how can I change some of my lifestyle before having a child. This is my first child with RX Kids, and it allowed me to adapt. I was also, during this time, during my difficult pregnancy, I was also pursuing 2 master's degrees at U of M Flint. But like I said, with the difficult pregnancy, I made the decision to decrease my schedule to part-time so I could keep my good standing. But that meant that I was no longer eligible for FAFSA for that semester. And to have to think about these upcoming costs, a hospital bill, plus having to pay tuition out of pocket so I could stay in my program, there were some nights that I would cry about it. And this is, again, where RX Kids stepped in. That initial $1,500 payment was a lifeline. Half went to essential baby items like a stroller and a car seat, and the other half covered my part-time tuition, allowing me to remain in good standing. And after my daughter was born, of course, there was the $1,300 a month for daycare. But now that we are off the program, having the $500 a month really allowed us to again, budget, and we are in a much better place, stress-wise, where we are able to manage those funds because we had time, we had a year to prepare. And I also think about the choices other working moms have to make because sometimes those expenses, especially daycare, outweigh your salary. And that was something I really had to consider, especially being in school. And I'm really grateful that because of that buffer, that's not a decision I had to make. I am still in the workforce. And this past June, I proudly received my master's in organizational leadership, and I'm on track to receive my MBA this December. RX Kids provided the crucial support I needed to continue investing in myself, which in turn allowed me to better support my family and continue contributing to Flint's community development. It's more than just cash, it's an investment in the potential of mothers, the stability of families, and the futures of communities. I really am so grateful for this program. It has given me a peace of mind that the flexibility that the cash gave me and the lack of reporting allowed me to focus on being a mother, which truly is my most important role. Why I pursue everything is for my daughter, for my family, and RX Kids really gave me that foundation. Thank you so much.
Thank you so much for your testimony, and I'm not saying any questions, but I want to thank you again for putting a personal touch on why this has been beneficial to your family and the state of Michigan as well, so thank you. Next, I want to ask Tom Hickson from the Michigan Catholic Conference up to the microphone. So if you could dazzle us with your presentation, Mr. Hickson, we would all be dazzled.
Thank you, Mr. Chairman. It's going to be hard to dazzle after we had some wonderful clients that probably could have delivered my testimony better than anyone, so that was awesome to hear. Again, Tom Hickson, Vice President for Public Policy and Advocacy with the Michigan Catholic Conference. MCC is happy to be here today to support Senate Bill 309, legislation that codifies the RX Kids program into state law. We thank Senator Santana for bringing this bill forward. Thank you. This program has been a wonderful help to expectant mothers and their babies who need extra support during this critical stage in both the life of mom and baby. From the Catholic perspective, RX Kids promotes the dignity of human life by supporting mothers who may be in very difficult situations. By helping mothers pay for critical prenatal and infant health care services and other expenses surrounding childbirth, RX Kids can help mothers provide their babies the care they need while in the womb and after they are born. Also, from a Catholic perspective, RX Kids is a positive step toward combating poverty. As mentioned, the costs of pregnancy and childbirth are very expensive. It is precisely at this time that babies are undergoing their most important development, as Dr. Mona said earlier, and the support provided by RX Kids can ensure a family's lack of resources is not a barrier toward giving their children a healthy start in life. Last session, we were proud to support the line item for RX Kids in the state budget and are happy to see this partnership expand into other areas of the state. This is a great example of a successful partnership between philanthropic organizations, the state, as well as local communities. By using a model that requires private dollars and a local buy-in, the state funds are very effectively used. You could argue, and I think the argument's been made today, that dollars spent here will almost certainly prevent greater budgetary expenditures on a wide variety of other programs in later years. We are grateful to support this legislation, and I'm very happy to answer any questions.
Thank you, Mr. Hickson, for your testimony and for speaking up on behalf of the Catholic Conference and Catholic congregations on behalf of this poverty-fighting program. I'm not saying any questions, so I'll thank you again for your testimony. And next, I want to welcome up to testify Chairman Austin Lowe's. Chairman Lowe's is chairman of the Sault Ste. Marie Tribe of Chippewa Indians. The largest tribe east of the Mississippi, and I would say the greatest tribe east of the Mississippi as a member. And I want to thank you for your leadership on helping this program be extended to residents in the East Urban Peninsula. So thank you for your testimony today.
Good afternoon. Chair Irwin and members of the committee. Thank you for the opportunity to speak on behalf of the Sault Ste. Marie Tribe of Chippewa Indians about the RX Kids program. For those who aren't aware, the Sioux Tribe is the largest federally recognized tribe east of the Mississippi River. Our 7-county service area covers the eastern half of the Upper Peninsula, where we provide a wide range of services to our members, including education, healthcare, recreation, cultural programming, and so much more. Prior to being elected the chairman of my tribe, I was a social worker where I helped to connect Native families to critical resources to support their health and their well-being. So I bring to you today both my perspective as an elected leader of my tribe as well as my professional expertise. From my professional experience, I can confirm that the research is absolutely clear. The earliest years of a child's development set the foundation for the rest of their lives. 85% of the brain develops occurs before the age of 5, and the stressors that parents may face during and immediately after pregnancy, such as housing insecurity, lack of access to healthcare, income instability, can disrupt that development. And as any parent will tell you, having a child is so incredibly expensive. Hospital fees, food, diapers, and supplies can add up to tens of thousands of dollars in that first year alone. These costs can cause significant stress and instabilities for families. By closing these opportunity gaps and providing a more stable environment with less stress and more caregiver interaction, we can create solid foundation for lifelong success. So when my tribe learned about the RX Kids program and the opportunity to help provide stability to families, we were so eager to help bring that to our region. RX Kids was made available to families in 5 of the 7 counties of our service area. And that includes Luce County, Mackinac, Alger, Schoolcraft, and Chippewa. And even though we're just 6 months into this program, we're learning that providing expecting mothers with $1,500 during their pregnancy and $500 a month for the first 6 months after birth has been completely transformative. So far, 307 families have been enrolled and 179 babies have been born under this program, with about 25% of them being Native American families. The initial surveys coming back tell us that the top 5 things that mom used this unrestricted cash for is baby supplies, food, utilities, rent, and clothing. 84% of moms in our region told us that RX Kids helped them make ends meet financially. 65% say that RX Kids has made it easier to get the health care that their household needs. 68% agreed that RX Kids has helped improve their health and their infants' health. To quote one mother enrolled in the program, RX Kids has made our lives less stressful and it's allowed us to make healthier choices. Another one told us that using RX Kids payments to cover unforeseeable medical bills during my pregnancy greatly reduced the amount of stress I felt during this time. I was able to focus on caring for myself and my baby. This tells us that this program is working exactly as it was intended. It's creating stability, reducing stress, and allowing parents to focus on providing the care and attention that their kids need. My ask for you today is that I urge you to continue investing in RX Kids. This is a model program that is creating healthier children and stronger families. And it's an investment that Michigan is making that will return a lifetime of dividends for our communities. Thank you.
Thank you so much, Chairman Lowe's, for your leadership on a wide range of issues, but particularly for your testimony today and your leadership on RX Kids in the Eastern Upper Peninsula. I want to recognize Senator DeMoose.
Thank you, Mr. Chairman. You know, one thing I want to make a point of, and this leads into my question, is that we have this report from the Senate Fiscal Agency that says that this could cost the state $750 million. But it's really important to remember that the program is actually very much dependent on a public-private partnership with lots of contributions. And right now, if I'm not mistaken, it's running at about 5 to 1 of private and other groups donating money versus $1 spent by the state. So I don't think we're going to ever get anywhere near $750 million of state funding based on the way the program's run. So if that's true, I want to make sure that we understand, what does this look like to a donor? And so you've contributed, your tribe has stepped up to the tune of $200,000 in the Eastern UP, which I thank you for as a person who represents that area. But you're approached by so many different ways you can become involved in society and everybody comes to you, I'm sure, asking for help with things. How does this program stack up to other things? And what makes this appealing so that we know, because it's important we understand that, because we don't want to spend $750 million of state funding. We need the donors to contribute to.
So I appreciate that question, and it's true that the Sioux Tribe has donated $200,000 to this program. I'm incredibly grateful for my tribal council to make that pledge and that allocation, and quite simply, they did it because they believe in this program. And how well this program stacks up to other programs, it's the best program I have seen, which is why we made the contribution. I mean, any investment that you make in your children is an investment in your future. And in my tribe, we talk a lot about the 7 generations, leaving the next 7 generations in a healthier condition than the current one. And this program definitely achieves that, and we're so grateful that it exists.
Which Chairman Lowe's. Oh, wait, we see another one from Senator Shink.
Thank you. I think one of the things that really, when I'm looking at the map of the places where this program has been functioning for a short time and where it's planned to come online, is that it's all over the state, that the need is across the state. And in my district, because we have to ask a question, so I'm going to ask you a question. In my district, there are families who are living on $10,000 and less. Do you think that could make a big difference in their lives?
Absolutely. I think it will make a big difference in families' lives that earn much more. I mean, in my community alone, the cost of living has gone through the roof. The cost of housing has skyrocketed. Every little bit helps. And I mean, it wasn't that long ago where I had my second child and I was in grad school studying to become an outpatient therapist. And the organization had a rule, like if you didn't accept insurance, you could get $2,000 back, which isn't that much different than what this award is. And I was one of those families that, I'll rely on my tribal health center to meet my health care needs, and I'll take that $2,000 because it's so expensive raising kids. I've been there, you guys approving this, it helps so many people.
Thank you again, Chairman Lowe's. And while I am asking Steve Hall, the Health Director of Central Michigan District Health Department, to come up and testify next, I do want to mention that it's been brought up by a couple members, there's a Senate fiscal analysis that would estimate that if this were statewide and the state covered every dollar of the program, it would cost $750 million. I just want to point out that based on what some people are proposing right now for an annual outlay for Michigan's roads at $9 billion, this would be less than 10% of that. So, there are a lot of people in Michigan. There are a lot of people to serve. I think that we all know what poverty looks like in our districts and how many people this can help. So I appreciate hearing all the positive things about it, and I like to put some of these investments in perspective, in terms of what this would mean for state government if we were put in a position to pick up every dollar that this program would cost if it were available to every resident. With that, I want to recognize Steve Hall, once again, the Health Director of the Central Michigan District Health Department.
Thank you. I don't know what I did to have to come after all that great testimony, but I appreciate the opportunity to speak before you today. I am the health officer with the Central Michigan District Health Department. We cover Aranac, Clare, Gladwin, Isabella, Osceola, and Roscommon counties. Clare County just launched the RX Kids program on August 1st. I must admit, when I first heard about the RX Kids program starting in Flint, I was skeptical. I thought, does giving no strings attached cash to people make sense? Will they spend it on appropriate things? The data clearly shows that this program is highly effective. 88% of participants reported improved financial security. 86% of pregnant participants attended prenatal appointments. 96% of participants with infants attended pediatric visits. 84% of moms report increased confidence as parents. RX Kids moms have better maternal mental health and well-being and are less likely to suffer from postpartum depression and anxiety. The data also shows that moms are going to their prenatal care visits, getting prenatal care earlier, and reducing smoking, which is preventing severe complications from the mother and baby. This has led to positive impacts on birth weight and a reduction in preterm births, averting costly NICU stays and improving infant health. The data also clearly shows that participants primarily spend their cash on baby supplies, food, rent, and utilities. This is just a small sampling of the available data that won me over and points to what an amazing program this is. Why was RX Kids so important for Clare County? Clare County is one of the poorest and unhealthiest counties in Michigan. The poverty rate for children aged 0 to 5 in Clare County is 39.6% compared to the state average of 19.9%. 61.5% of our children aged 0 to 18 are insured by Medicaid, compared to the state average of 47.1%. Clare County is very rural. Access to health care is a huge issue. There are no birthing hospitals in Clare County. In fact, we only have one birthing hospital in my entire 6-county jurisdiction. There are also no pediatricians in Clare County. Our families often must make difficult decisions. Do I put food on our table, or do I go to my medical appointments? A pregnant mom that spoke during our kickoff event mentioned that she had to go to Ann Arbor once a month for medical appointments. That puts a tremendous financial strain on her family, something that this program will help. We had 13 applications on day 1 on August 1st. As of today, 31 families are already enrolled. Our health department's mission is to promote health and physical well-being by providing preventative health care, education, and environmental safety to all members of our community. We are proud to be the local champion of the RX Kids program because we know that this will make a positive impact in our community by improving the health of our moms and babies. As Dr. Mona says, RX Kids is a prescription for health, hope, and opportunity. It's an innovative public-private partnership. I applaud the state for utilizing temporary assistance for needy family dollars for its intended purpose, helping families in need. I would love to see this program expanded, especially to the other 5 counties within our jurisdiction. It's a wise investment in our future. Thank you.
Thank you, Mr. Hall, for your testimony and for particularly that last comment about using TANF dollars for its intended purpose. I felt like maybe there was even a little bit more behind that than was meant around RX Kids. At least that's what I hoped, because that's what I heard. Any other members want to have any questions for Mr. Hall or say anything else for the good of the order? Seeing none, I want to also thank Dr. Lou Schaefer from the University of Michigan Poverty Solutions, who's been a part of this and was on Zoom in case there were any technical questions, but we didn't have any for Dr. Schaefer, and I'm hoping that we will see this bill come back before the committee before long. So having said that, let me ask the clerk to read in any testimony card.
These are all not wishing to speak in support of Senate Bill 309. Patrick Schaefer with the Michigan League for Public Policy, Tashina Williams from the Michigan Council for Maternal and Child Health, Colin Ford from the Michigan chapter of the American Academy of Pediatrics, and Nathan Murphy from the Council of Michigan Foundations.
Thank you very much. There being no further business before the committee, without objection, the Senate Committee on Housing and Human Services is adjourned.